How about on the Advantage plan? I mean, what does that look like when I'm going to the doctor, I'm having surgery? What does that look? Am I paying nothing or?
It's going to vary drastically based on your service area,
Okay.
right? And that's the county that you live within. I mean, we've seen people in one county, have just phenomenal options, very, very competitive. And then one county over, some of those same plans aren't even there. So it does depend on your service area. Plans could be extremely competitive and have very low out-of-pocket exposure when you use the plan. Contrary to that, you could have a lot of exposure. You could have a lot of out-of-pocket. You get a surgery done or you go to the hospital.
Got it.
It does vary. But typically, I would say this, typically Medicare Advantage plans in general have really three big items, three big areas you got to be aware of. Number one is skilled nursing care. Number two is hospitalization, inpatient hospitalization. And then number three would be PT, OT, and ST, physical therapy, occupational, speech therapy. Very, I would say, I don't know if common is the right word, but things that happen that people will typically face at some point in their life, these type of things. And financially, it can be burdensome if you haven't planned accordingly.
Can you speak to the skilled nursing care a little bit more? I feel like, a lot of people are unfamiliar with what that actually looks like or what that is.
Yeah. So skilled nursing care, I mean, you're going to have a 3-day hospitalization prior to getting it covered by Medicare, 3-day hospitalization, and you're covered for up to 100 days. After that, you have to be showing improvement as well. There's a couple little caveats there, but it's only limited to 100 days.
Okay.
After that, there's no coverage.
Wow.
And that's a big, big financial risk to somebody who has some retirement resources. So this is an area where you really got to be aware that you could face that financial risk, and there's ways to protect it for very, very competitive and affordable ways. Very, very, just really good options out there.
So it sounds like it's kind of like an inpatient rehab service, like after a major hospitalization, major surgery, something along those lines. So after you've got to be an inpatient stay, like you said,
right?
But it ends up being rehab essentially, but it's done as an inpatient. So safe to say, once they've done their stint there, their time, they're probably going to go and get the outpatient therapy you were just mentioning before, right? And so,
right,
and you see how they all tie together and lead to they deal with bigger cost as these things go on, right? You have the hospitalization, but the point I think that you're making is that you're gonna pay when you use it. It depends on where you live, right?
Yep.
What plan you have, but you're gonna have copays. You're gonna have things that you have to pay for when you use the coverage. Okay,
exactly.
that is a pretty stark difference between the two, then, right? On one hand, you're paying extra for something, really with the hope that you'll never have to use it, right? But if you do need to use it, you got peace of mind, right? You're like, hey, I pay very little, if anything, out of pocket, can go wherever I want. On the other hand, though, you got the people that are more akin to some of that risk. They like the idea of paying as you go.
Correct.
Right? Like you remember those phones that was the pay as you go phones that were you buy your minutes for the month, right? Essentially the same principle is I don't want to pay I don't want to pay a contract. I want to pay when I go to use the coverage.
Right. Exactly.